Hello, myself Sayyid Misbah Mubarak, student of second year MBBS. Today my topic is antihelminthic drug. So let's start. So first of all, what is the meaning of helminthis? Helminthis means worm. Now, one third of population suffers from the helminthiasis, but more common in the developing countries with poorer personal and environmental hygiene. And this helminthiasis is more commonly transmitted to fecal-oral routes, thus the GIT become the common site of the lodgement. Now, what are the signs and symptoms of helminthiasis? So, diarrhea and dysentery is a common sign. Abdominal pain, subcutaneous nodule, allergic reaction, injury to the visceral organ, conjunctivitis, retinitis, and blindness, and hepatosplenomegaly. These all are the symptoms of helminthiasis, and this clinical symptom arises mainly due to toxin production. Okay, now let's see the classification of helminths. So there are three class: tapeworm, flukes, and roundworms. So tapeworm, cystode. Example of tapeworms are Taenia solium, Taenia saginata, Hymenoplepsis nana, and Echinococcus granulosus. Now what are the example of flukes? That is trematodes. So Fasciola hepatica. And what is the example of roundworm? Ascaris and Encyclostoma duodenale. So now we'll see what are the pharmacological targets. So helminths depend upon the host glucose for the basic metabolism. So how we can kill the helminths? Simply by blocking the glucose uptake of the helminths. So the example are benzoimidazoles and levamisoles. They have moderately developed muscular system which can be stimulated or inhibited to produce tonic or flaccid paralysis through different receptor mediated mechanisms. Examples are piperazine and levamisole. They produce energy by the anaerobic pathway as well as from oxidative phosphorylation. Then example is niclosamide. Cell membrane act as a barrier between the internal and the external environment which can be perforated. Surface adhesion molecule can be altered. Example is praziquantel. So let's move forward. Now what are the antihelminthic drug classifications? So we'll see further. Benzimidazole. Examples as albendazole, mebendazole, and thiabendazole. Next is diethylcarbamazine, ivermectin, levamisole, salicyclides, and praziquantel. Now we'll move forward. Now we will see single drugs and what are the advantage, disadvantages, what are the adverse drug reactions and further uses. Okay, so the first drugs is mebendazole. Benzimidazole, cogner of thiabendazole, become popular because of its retained broad spectrum anti-helminthic activity but not the toxicity of its predecessors. 100% cure, reduction in the egg count in roundworms, hookworm, and Enterocystis trichuris infestation, but much less active on the strongyloids. Up to 75% cure reported in the tapeworm. H. nana, Hymenoplepsis nana, is relatively insensitive. Action of mebendazole is rather slow. It takes 2 to 3 days to develop, and poor intestinal absorption. Now we'll see what are the contraindication of the mebendazole. So first, we'll see the mechanism of the action. So, it binds to the beta tubulin of susceptible worm with high affinity and inhibits its polymerization. It acts probably by blocking glucose uptake by parasites and depletion of its glycogen stores. Microtubule in the worms are gradually lost. Now, what are the adverse drug reaction of the mebendazole? So, well tolerated even by the patients with poor health. Diarrhea, nausea, and abdominal pain. Expulsion of ascaris from mouth and nose has occurred. Now allergic reaction, loss of hairs, and granulocytopenia at high doses. Next, what are the uses? Multiple infestation, that is roundworm, hookworm, whipworm, enterobius, and etc. Hydrated disease. Trichuriasis effective than albendazole. Mass treatment but need of large dose is a drawback. Now next we'll see albendazole. It is cogner of the mebendazole with retained broad spectrum anti-helminthic activity and well tolerability. Now what is the advantage? A single dose is enough in many cases, example Escherichiasis, hookworm, and enterobiasis. 3 days treatment with mebendazole. Superior to mebendazole in strongyloids, hookworm, and hydatid diseases, but inferior in trichuriasis. Now, mode of action is similar to that of the mebendazole. Now, what are the adverse drug reactions of albendazole? So, GI side effects like abdominal pain, diarrhea, bowel upset, dizziness in few cases, headache, fever, jaundice, neutropenia is prolonged in use. It should not be given in the empty stomach for intestinal worm, but for cysticercosis, hydatid disc disease, and cutaneous larvae, cutaneous larva margins, it should be given within fatty meals. Now uses ascaris, hookworm, enterobius, tapeworm and strongyloides, neurocysticercosis, cutaneous larva migrans, hydatid disease, filariasis. Now next is thiabendazole. It is the first benzymadole introduced. Antihelminthic practically covers all species of nematode. So this thiabendazole, it covers all species of the nematodes. Also inhibit development of egg and kills the worms. Now mode of action, it is same as the mebendazole. Also exert antipyretic, analgesic and anti-inflammatory effects. Contribute in cutaneous larva margins and larva or worm induced inflammations. Now we'll see what are the adverse drug reactions. So loss of appetite, headache are common, impaired alertness, interfere with normal activities, itching, abdominal pain and diarrhea. Now what are the uses? Practically against all nematode infesting the gastrointestinal tract. But because of frequent side effect and poor patient accessibility, isn't used regularly these days. It is used only when other better tolerated drugs are in the effective. Now next we'll see the piperazine. So piperazine is highly effective drug against ascaris and enterobius with 90 to 100% cure rates. Okay, but second choice of drug these days. Now what is the mode of action? So it causes hyperpolarizations by GABA agonist action and at open chloride channel resulting in relaxation, decreased responsiveness of worms muscle to acetylcholine. So it basically causes the flaccid paralysis. So now next is what are the adverse drug reaction of the piperazine. So abdominal discomfort, urticaria, dizziness and excitement at high doses. Toxic dose produces convulsions and death, that is respiratory failure. Now next is it is safe during pregnancy. It is very important that piperazine is safe during pregnancy. Now what are the uses? Ascaris and enterobius infestations, intestinal obstruction in pregnancy when other antihelminthic are contraindicated. Now we will see levamisole and tetramycin. So levamisole and tetramycin, these both are optical isomers. Okay, levamisole is more active and more preferred. They are active against large number of nematode, but the use is restricted to only ascariasis and encyclomyces because of poor action against other worm. Now what are the mode of action of levamisole and tetramycin? They stimulate ganglia in worms and cause tonic paralysis, expulsion of live worms. May also interfere with carbohydrate metabolism. Okay. Now the adverse drug reaction is nausea, abdominal pain, fatigue, drowsiness or insomnia. Okay. Uses ascariasis second line in duodenal infestations. Now we'll see next drug, that is diethyl carbamazine citrate. It is a first drug for filariasis and it has highly selective effect on microfilariae. Now what is the mode of action? It alters the microfilarial membrane so that they are readily phagocytes by the tissue fixed monocyte but not by circulating monocytes. Muscular activity of microfilariae is also affected, causing hyperpolarization. Okay, so it is important that this DCA, this microfilariae, is not phagocytes by the circulating monocytes. These are phagocytes by tissue fixed monocytes. Now, what are the adverse drug reactions? So it is not so serious. Just nausea, loss of appetite, headache, weakness, and dizziness are usual. Okay. So rash and pruritus, lymphadenopathy, hypotension, these all are the adverse drug reactions. Now let's move forward. Uses filariasis produce a rapid symptomatic relief. Okay. Now next we will see niclosamide. So niclosamide is highly effective against cystode infecting man. Now mode of action, it acts by inhibiting oxidative phosphorylation in mitochondria and interfering with the anaerobic generation of ATP in the tapeworm. Okay, next is what are the adverse drug reaction of the niclosamides. So tasteless and non-irritant, minimal absorption from GIT, so minimal systemic toxicity, minor GI syndromes are produced, malaise, pruritus, light headachenes. Okay, now it is safe during pregnancy, so it is very important and it is not contraindicated in the pregnancy. It is safe. Now praziquantel. So praziquantel is novel antihelminthic broad range of activity against trematode, cystode, but not nematode. Okay, so praziquantel is not effective against nematode. So what is the mode of action? So rapidly taken by the susceptible worms and cause leakage of intracellular calcium and contracture and paralysis, loss of intestinal mucosal grip, expelled. So now further we'll see what are the adverse drug reaction of praziquantel. First of all, it is a very bitter in taste. So it bitter in taste and it causes nausea, abdominal pain, headache, dizziness, and sedation. Okay, so uses to tapeworm infestation, neurocysticercosis, and drug of choice for all fluke except liver fluke. Okay, so thank you.